Exercises are very important to helping your shoulder heal. To begin, you will do exercises in which you do not actively use the muscles in your healing shoulder. These are called passive motion exercises. They help you regain movement in your shoulder. When it is safe to do so, you will graduate to exercises that begin using the muscles in your healing shoulder with the help or assistance of your other arm. These are called active assisted exercises. The last phase of exercise involves stretching and strengthening the muscles in your healing arm. Only do your exercises on the schedule provided by your surgeon or physical therapist. It can delay your recovery to do active assisted, stretching, or strengthening exercises too soon. To protect your shoulder, do not do any exercise until your surgeon or physical therapist has shown you how to do it. Follow his or her instructions. Do not move your healing arm any farther than he or she tells you to move it. Do your exercises slowly and gently. You may feel some discomfort in your healing shoulder even before you begin your exercises. But if pain increases while doing an exercise, stop right away and relax your shoulder. If the pain returns to your starting level after you stop the exercise, try it again, slower and with less intensity. If you continue to feel increased pain, even though you've stopped the exercise, talk with a member of your healthcare team before continuing to exercise. You will need a helper for these exercises. Lie down with folded towels under your elbow to keep it forward. Your arm needs to be released from the sling. Before beginning the exercises, do some movements to warm up your elbow and hand. Start with your elbow bent so your healing arm lies across your stomach. To warm up your elbow, your helper gently straightens your arm so it is even with your leg on that side of your body. Your arm should stay close to the sling. To warm up your hand, make a tight fist, then spread your fingers. For the first exercise, start with your arm lying across your stomach, palm down. Rest your elbow on the folded towels. Relax. Don't use the muscles of your shoulder or arm. Instead, your helper gently moves your forearm away from your body. Your elbow should stay at your side. Do not allow your arm to be moved any farther than you've been told to move it. Do not allow your arm to be moved to the point that you feel increased pain. Breathe normally as you exercise. Don't hold your breath. For the next exercise, your helper puts one hand under your elbow and grasps your wrist. He or she moves your forearm away from your body to the point that you feel a stretch. Then your helper gently pushes on your elbow to guide your hand toward your head. Do not use the muscles of your shoulder or arm. Do not allow your arm to be moved any farther than you've been told to move it. Do not allow your arm to be moved to the point that you feel increased pain. An exercise called dangling involves a motion you'll use for dressing and other activities of daily living. Ask your helper to remove your sling for this exercise. Support your healing arm with your other hand so it doesn't drop. Stand next to a counter or a sturdy piece of furniture with your legs shoulder-width apart and your healing arm in front of your body. Bend at the waist, supporting yourself with your other arm. Lower your healing arm until it dangles like a necktie or scarf. Straighten up and grasp your healing arm with your other hand, bending it at the elbow. Keep your arm close to your body. Keep your elbow in front of your body. Don't use the muscles in your healing shoulder. The other arm does all the work. If necessary, you can do this exercise while seated. Faithfully doing your passive motion exercises is an important first step to helping your shoulder heal.